Hi, everybody. All right, let's go on to topic Tuesday. This is going to be a juicy, informative one. Uh, this one, we're talking about beta blockers. Now, if you go under resources, you will see that there is a PDF in there all about medications from Dr. Kristen Watson, who is a doctor of pharmacy. This is specifically written by Ahmed, who's our uh, medical student, but he's really dissecting, haha. He's really getting in there and talking about the what, where, when, how, all the issues that happen with a beta blocker. Beta blocker. So this is one of the most commonly prescribed medications in America, believe it or not, and it's for good reason because when you take it the right way, when appropriately taken, they can help protect long-term heart function and prevent cardiovascular disease progression. So it's a lot more than just worrying about our blood pressure and stuff like that. There's a lot more that beta blockers actually do. So let's get into this a little bit. All right, so let's talk about what beta, as part of beta blockers, what's a beta receptor and what does it do? So the two main classes of beta receptors in the body is beta 1 and beta 2. And a beta 1 receptor works mainly in your heart and your kidneys, okay? And in the heart, activation of beta 1 receptors causes increased heart rate and heart contractility. How's that? You know, I did do homework before I did this. I did pronounce a lot of words you guys are going to see so that I would know how to pronounce it. Contractility. That sounds right. There you go. Essentially meaning your heart is beating strong and fast. Okay. And as you can imagine, this might put a lot of stress on your heart as it works to keep up the pace. So activating that beta 1 receptor is what makes our hearts work harder and faster. And in the kidneys, when beta 1 receptors are activated, renin, angiotensin 2, that aldosterone cascade. Wow. Okay, that gets activated. Renin, angiotensin 2, aldosterone cascade gets activated. Do you know what that is? This is a long stepwise metabolic pathway that eventually results in absorption of water and salt in your urine, causing an increase in blood pressure. So when beta 1 gets impacted, your heart becomes affected. And when beta 2 gets impacted, your kidneys get affected. All right. So beta 2 receptors, when beta 1 gets affected, it can affect your heart, working harder, faster, and it can affect your kidneys. And that would result in the absorption of salt and water in your urine, and that will increase your blood pressure. Let's talk about beta 2. I'm going to take a deep breath so I explain it all correctly. That predominantly works in your blood vessels and your lungs and your heart. So in the blood vessels, activation of the beta 2 receptors causes smooth muscle contraction and decreased blood pressure. In the heart, activation of beta 2 receptors increases your heart's contractility. It's going in the blooper reel for sure. This is like the other word that just destroyed me. Contractility. Contractility. I just had to hear it. Contractility. Doesn't that sound right? You're just letting me go. You're just letting me go and really dig a hole. All right, we're moving on.
You're
In the
killing it.
lungs, contractility. Okay. In the lungs, activation of beta 2 receptors causes bronchial relaxation, allowing the air to flow smoothly through the lungs. So here's a fun fact. You know the popular asthma drug albuterol that people take? That works by activating the B2 receptors, the beta 2 receptors in the lung, which helps improve breathing. There's an idea of the B receptors. Okay. B1, heart rate and contractility goes up. B2 releases renin and it increases your sodium and water retention. So, beta blockers. They come in two main classifications: non-selective beta blockers, which work on both beta 1 and beta 2, basically canceling out their downstream effects. So while this can be useful in some regards, such as lowering your blood pressure by reducing the cardiac pumping and salt water reabsorption in the kidneys, it may have some unintended consequences, such as bronchospasm and difficulty breathing due to a beta 2 blockade. All this interesting scientific stuff, okay? Alternatively, some people may be more familiar with the cardioselective beta blockers, such as the famous Lopressor or metoprolol. Okay, that's a famous, well-known cardioselective beta blocker. And these drugs actually function to block only the beta 1 receptors in the heart, allowing them to reduce strain on the cardiac and aortic muscle, while avoiding any unnecessary side effects from beta 2 blocking, like the increase or reduction of urine output because of the increase of saltwater absorption. So the following table summarizes some common beta blockers in each class. Here we've got a lot of these listed. You've got things that would affect your beta 1 receptor would be all of these, the LOLs, as we call them, the LOLs. They're all the drugs that are in the beta blocker category. And so antenolol, that's one that people hear about often, metoprolol, nebivolol, those are all pretty well-known drugs that people would take. In the non-selective, some of the ones you might have heard of is carvedilol, labetalol, propanolol. These are all drugs I've heard you guys talk about. So even though if you're taking a metoprolol and you're feeling some side effects from that, there are other drugs in the beta blocker category that you could be prescribed, whether it's cardioselective, specifically for heart and lungs, or it could be non-selective. So that's why it's really important that you talk to your physician about how you're feeling when you're on these medications so they can determine if they want to make a change, right? So for physicians that have had an acute aortic dissection, cardioselective beta blockers are actually used to quickly decrease the stress on the heart and on the aorta. That's why in the hospital, what do we get? We get labetalol or we get metoprolol. Those are the two most common that you're going to find in the hospital. It's a quick acting dose of, they also might give you a quick acting dose of esmolol to inhibit B1 receptors and slow down your heart rate in anticipation of needing further imagery or needing surgery. People who have survived an aortic dissection are usually placed on long-term oral beta blockers, and this is to reduce the amount of work that the heart actually does to pump and help offload some of the shearing stress on the aortic wall, which will help reduce the risk of a repeat dissection. So when people say, why are we all put on metoprolol? That's your reason why. That's why everybody's put on that as first line of defense. Now, other conditions in which beta blockers are very commonly used would include patients after a heart attack. And that's to reduce, again, heart strain on a weakened cardiac tissue and patients that are having heart failure. In fact, beta blockers are one of only 4 drug classes that have been shown to prolong life expectancy in patients with heart failure. So heart failure would lead you to want to take beta blocker. And I wonder if you would know what the other 3 would be. So let's talk about the other 3. If he talks about them right here, he might talk about them next week. You never know. Non-selective beta blockers have also shown utility in many non-cardiovascular conditions, including, but not limited to, hypothyroidism, anxiety, and tremor conditions. So if you want more information, there's a lot of video and links there. I know also they can be used if you're having a lot of heart arrhythmia. Sometimes you increase the beta blocker, which helps offset the stress that's happening because the heart is in a different rhythm. So these beta blockers are really great drugs. And when people say, why am I on labetalol? Why am I on this? These are some really good reasons why. And in slightly technical terms, but I think he did a great job explaining them for the people who can't pronounce the words and may have difficulties understanding. I hope I helped you understand that a little bit. And that's your Topic Tuesday.